for me, go ahead and start. Tell me your name, your profession, what you do in the human services field, and we'll just kind of roll from there.
Okay. First of all, thank you for having me on your roundtable. I do appreciate being able to be here with you. My name is Dr. Beverly Smith. I'm currently the president and interim CEO of the American Mental Health Counselors Association. I've been in the field for over 25 years in various capacities. I've worked in various settings, such as public education, higher ed as an adjunct professor, which I currently still am, private practice. I have my own consulting firm, behavioral healthcare consulting firm, called BSmith Consulting Group, LLC, and I've been doing that for over 10 years. I'm licensed in the state of Georgia as a licensed professional counselor, able to do therapy and clinical work. I'm able to assess, diagnose, and treat in the state of Georgia, as well as in the state of Alabama. And so that is kind of an overview, a broad stroke overview, if you will, of who I am, what I've done. And so that's part of what I do.
I don't think I asked, or maybe we did. Are you located in Georgia?
I am located in Georgia. I am a resident of Georgia. I am a native of Georgia.
I don't know why that didn't come up our first conversation. I live in Sandy Springs, and I was born and raised in Georgia. Yeah. Mm-hmm.
Awesome.
Yeah, that's cool. You're the first person exactly. You're the first person I've interviewed that comes from my home states. That's really exciting. We can talk about that more later.
Okay, I'm sorry.
No, you're totally fine. I was really excited too. That's great. I'm kind of obsessed with Atlanta, so it's really. I always tell myself, okay, if I'm going to make an impact, it's got to be here first. Mm-hmm. So you are a counselor, a therapist. What do you tell people? Which is a better term?
We talk about terminologies. I do go by the term psychotherapist or licensed professional counselor. I think many years ago, we used the word counseling, and there was such term as guidance counselors and so forth. But as we move forward, as a profession has evolved and grown, we use the word licensed therapist, licensed professional counselor, as well as licensed mental health counselors. Is there a term that we should or should not use? It's okay, as long as you're licensed to practice and do the scope of work that you're advertising that you can do.
Was there a point, some time in the recent past, where putting the word licensed in the beginning became necessary? Is there a wave of holistic people? They're how to clarify, licensed. That's important here.
Well, it's interesting that you asked that. I think we do now put a more emphasis on license so that we inform the public. We inform individuals of who we are and the services that we provide, because we do have a lot of individuals who are maybe in the field of providing helping services, but it doesn't mean that they're licensed. You have individuals who are doing coaching. You have individuals of very aspect of counseling or psychology. And saying that you're licensed is just a way of informing the public of the fact that you've met certain standards, you have certain credentials to practice and do no harm, and that we follow a certain guideline or standard that we adhere to. So that's the importance of saying license.
Yeah, terminology is fascinating, and we touched on that on our first talk, but we'll come back to it. I want to go back 25 years ago, and I'm interested, I'd like to pick your brain about how you ended up in, psychotherapy counseling, pick your term, and what kind of brought you there.
Interesting. If I reel it back to many years ago, it feels like I was a graduate student, actually at Tuskegee University, where I obtained my master's. But prior to that, I was a biology student, a research assistant on a NASA project that was at Tuskegee University. So I was a research assistant working on a project in which we were growing sweet potato NFT, nutrient film technique for space missions. And so from that place of having various workshop sessions and facilitators to come in to talk about the human parts of working together, of building the rapport, building a team. From that aspect of talking about building a team, how do you build a team? How do you maintain a successful team? I kind of at that point began to gravitate into, hey, I want to do that. I want to understand more of human development, how we function, how we develop, how we excel, what are the challenges and what are the hindrances? And then how do we talk about solutions? So I became more interested in that. And so it kind of was a launching pad for me of how do we move, how do I help and move forward in that arena? Specifically, there was actually a workshop or a session that all of the researchers and research assistants had to attend. And the session was 7 Habits of Highly Effective People by Stephen Covey. And that was the basis of the workshop. And so from that point, it kind of led me into that field of facilitating, helping people to understand how to be the best of who they are, how to give the best of them. And so to this day, I still remember, some of those 7 habits of putting first things first, sharpen the sword, sharpen the iron, keeping the end in mind. Those are a few things that I just remember to this day, and it's been 30 years. And those are some principles that have guided me in my profession as a leader and in my personal life as well.
I love to hear that for sure. Lessons crossing those lines because they're already blurred as it is, right? So I want to highlight what I think I'm hearing you said in your experience is that you were in a setting that had nothing to do with psychology or therapy, and it was in that moment that you found an intrigue in the way humans function, the way they think, the way they interact. So it kind of came from like a group setting and then just has shifted into helping individuals. Is that right?
You're absolutely right. Now, I've always been an individual who liked to help people, who wanted to give, wanted to just kind of comfort people. And I was always told that I was a great encourager. I had the gift of presence to encourage people. But I'm not sure I ever thought about it as a profession, to help, to encourage, and to lead. And so at that point, you're right, in that group setting, that really was not about a career shift, if you will, or integration, but it was more so about how do we understand human behavior? How do we channel within ourselves to be the best for the team and for the organization? Now, interesting now, fast forward 20-something years later, there's a big conversation now about neuroscience and counseling, or just about neuroscience and mind-body connection. And so having a biology degree and then having a counseling degree, for me, it comes full circle. It allows me to pull from various aspects of my educational training.
Oh, that's great. I think it was just important to point that out because it is often we come to the helping services in a setting that in no way is related to social service or civil services or anything like that. It's more like not always, but it's more like a personal experience that really introduces us or pushes us into these type of roles. So I love that. So you started working with individuals, and what was that like in the beginning when you really started working directly with people and at a different time that is not today? Because I know that the whole perception, good and bad, of therapy and counseling has shifted so much in the last 10 years. So tell me how it was for you in the very beginning.
It truly has shifted a great deal. I think many years ago, people had a perception of that counselors just dealt with some normal life issues, and that to deal with the other aspect required, some psychoanalysts who you walked into office, you laid on the couch, and you listened to this male who was in the chair and with his leg crossed taking notes. Well, it's so much different and broader now in this day and time, and it's important to highlight that. As a licensed professional counselor, I've been trained, as I mentioned before, to assess, diagnose, as well as treat mental health disorders, deal with normal life adjustment issues, but also to deal with the more complicated issues. And was that the case many, many years ago? We had the training, But nevertheless, sometimes you have to train and you still have to evolve as a profession, and laws have to be enacted in order for you to practice within your scope. So that has happened over the course of the years. But if I recall back years ago, when I was a graduate student at Tuskegee University, one of my internships was working in a youth development facility for youth who were detained in detention, as well as some who were in inpatient or in treatment, if you will. And so I do recall those days. I recall juggling school and work and getting up at maybe 4:30 in the morning so that I can, be on duty by 5:30 in the morning. But that was an interesting experience to work with teens and youth who were troubled or who had challenges, and they now have legal challenges that were directing their services and their families, if you will.
Was there a lot of resistance from people, or shyness, maybe even a little bit of fear, that you witnessed a lot from individuals when you started?
Oh, yes. I witnessed a lot of resistance, denial. And guess what? We still witness some of that now. So that doesn't change because we're still dealing with the stigmas of mental health care of individuals should they not access mental health care. So there's a stigma still associated that's been still existing for years and years and years. I think we've made some great progress in that area, but there's still a lot more to go. But I remember how I build a therapeutic rapport now, maybe a little different than what I did when I was much younger and I started. I started out directly out of college, and I always wondered, okay, did I do this right? Did I do that right? And now, being in the field much longer, much more experience, I do it more now with the confidence, knowing that I know what I do. I know how to do what I do, and I do it well, and just relying on the fact that I was trained well. I've been in school a lot in getting counseling degrees in various areas of specialization. And so it's afforded me opportunity to just build my repertoire, my toolbox, to be able to help and to assist individuals just to improve their qualities of life and help them to, navigate through their challenges of life.
We keep kind of dancing around it, so let's just hop into the stigmas of mental health. And something I thought about before we hopped on this call is, I think I was just taking notes. Is mental health a broad enough term to really envelop everything that has to do with, how we transist with our thoughts and our feelings and our interactions, or does it go deeper than that? Because mental health maybe it's just the stigma that I'm subconsciously leaning on. But I don't think mental health, from my perspective, does really explain or inadvertently make people think of, consistent counseling or ongoing therapy or those sorts of things. It's kind of this very surface level idea of, okay, maybe it's self-care, or maybe I take some deep breaths. What are your thoughts on that?
Well, I think it's all of that. I think mental health is I don't want to say a big word. It's a broad term. And when we say mental health, there's just so many components of mental health. It doesn't necessarily mean we talk about mental health that an individual is experiencing challenges and so forth. When we talk about mental health, we're talking about mental health in totality. Everyone really has mental health. Now, in that category, in that space of mental health, you may be experiencing challenges in that spectrum or that continuing. You may be somewhere in the middle, or you may be somewhere where you're just excelling now and you're saying, okay, I don't have any challenges, but I do want to tend to my mental health. I want to enhance it. I want to make sure I'm doing the self-care, doing the things for maintenance purposes. Whereas you may have some individuals, and all of us in the course of our life have probably been somewhere at different places on the spectrum of mental health. Well, we're selling high and it's going great. But also we've probably been in the places where things haven't gone great. Maybe it's because we experienced some loss, some grief or death, or just a regular normal transition or maturation of life as a human being. And then there may be times we may find ourselves in the middle. So it's important to understand, we talk about mental health, we understand that all of us have mental health. It just depends on where we are on the spectrum of it. Can we demystify that word a little bit more? Absolutely. We can just demystify a little bit more. And I think as we begin to talk about stigmas and break down the stigmas and tell people they're not alone and allow people, create spaces where people can share their stories, we create spaces again for people to hear, to listen, to build bridges, to understand. And I think in those spaces and processes, as we begin to understand mental health more, we begin to embrace it more. We're no longer afraid of it. We don't hide from it, and so it becomes in the connection that we have with other people, talking with other people. It comes in the connection of professionals, having the conversations and creating the safe spaces and using the language that we know the public will understand. So all of us have a role in demystifying the term, which is very broad, of mental health. But also I would say to other individuals, as far as general public or even professionals, I would say take steps in embracing mental health, but also take steps in breaking down the stigmas of mental health. It's no longer the case that we should not be using the term just because the individual seeking help is that they're crazy or they're cuckoo. And those are terms in the past that, if we're honest and transparent, we've heard. And in some cases, some people have used those terms. But moving forward, we have to move to a place that we say those terms are no longer acceptable. When you talk about even diversity, equity, inclusion, mental health is a part of that. Individuals who have experienced challenges with their mental health, we have to be acknowledgeable and understand that that is a population that deserves attention from a DEI standpoint. They deserve equity. They deserve to be treated and respected as a human being, just as anyone else. I can get on my soapbox.
Oh, beautiful.
But I won't do it today.
That's okay. You sell all the soap you want. I love that. It's fine. You definitely helped me shift that perspective of the terminology and just the broadness of mental health. And what came to my mind as like an analogy or something similar there, I think people have a negative perception of our diets and their physical health. And I think when people hear mental health or it's the topic of conversation, a lot of people immediately assume it to be a negative thing. If we're talking about mental health, then there means there's a problem to be, solved, and not necessarily, as you said, that it's on a spectrum, just like our physical health or our spiritual inquiry, And so thank you for that. I appreciate it. And it just goes right back to that stigma that we kind of dragged ourselves into over the last 100 years, you said?
That's true. And you know what? It's about the awareness. It's about not even condemning anyone if they have had a misconception of mental health or the term or what it is or what it should be. It's not about condemning. It's just about, okay, how do we move forward to embrace? How do we move forward to create better understandings and safe places where, again, individuals can have those conversations and where they can belong? And that is important.
Safe spaces and creating those environments has, with no intention at all, been mentioned in, I think, the last 2 or 3 episodes. Mm-hmm. And I really am coming to understand just how prevalent that creation of space is. And so I want to touch on that a little bit. In your experience, is creating the space for people to find, therapeutic services with you, does that just include your own office, or does that expand to other areas, maybe in the community or people's own homes? What does that process look like from your line of work, creating environments for people to open up about their mental health?
I think for me, it goes more than it goes beyond the walls of the office. It goes beyond the walls of a therapy session. I think we have to be conscious of how we present ourselves as professionals, as therapists. We have to be conscious of the message that we send, of the services that we provide. Now, ultimately, individuals will make a decision if they feel like it's a good fit or not, and we respect that, and they should make those decisions after they have vetted and even searched around. That is fine. But who we are and how we represent ourselves in our daily lives makes a difference as well as creating safe spaces. The organizations that I'm affiliated with, the community service that I do it still based upon my values of who I am. And I serve as a professional. I serve as Dr. Beverly Smith based upon my values of who I am, of respecting people, of honoring people, of wanting to help people, wanting to encourage people. And that is important as we all create, that safe space. So I think it goes beyond just the office. It has to be a part of who we are as an individual to want to create safe spaces for people by respecting people, being confidential. Those are things that we just have to value first as a profession. One of the things that we're charged to do is to do no harm. And part of our ethics is to do no harm. As reference to AMHCA, we have what we call our declaration, our oath of the service that we provide. And we take an oath to say we will do no harm. And so in doing no harm, you have to create safe spaces. And not only create safe spaces, but to cultivate safe spaces. And that has been important for me as a clinician, as a leader, and as a human being to create safe spaces. When I think about the organization of AMHCA, the American Mental Health Counselor Association, as I serve as a president, interim CEO, one of the things I try to do, and even in our board meetings, is to model by example. And so with our board of directors, I model what it's like to be a leader, to respect everyone, even if we disagree or we have various views, because we're all looking through different lenses, But one of the things that I always say, I've said since I've been involved with AMHCA, is that conflict is inevitable, okay? But combat is optional. And so as we're leading and creating safe spaces, we have to be conscious that we're not creating spaces of combat, but just because someone has a different view or a different perspective. And so, in life, in the therapeutic room, we will always have a different perspective. But how do we walk through that? How do we lead through that with still respecting the individual and ensuring that when someone leaves us, their worth and their value is still intact and we didn't do anything to deteriorate that? And so all of that still helps with creating safe spaces.
Oh man, that was all beautiful. And I just first want to mark and just bring attention to you are confident, and I feel encouraged to use your words. You obviously know what you're doing, and I really appreciate that at a personal level. And then I know plenty of viewers do too. So there's my first question, and there's a couple things in there that I think are beautiful we should touch on, but I'll start with, I'm interested in if you do teach clients and other individuals that you work with how to create their own safe spaces and environments. And then I'd love it if you could break it down what it means to cultivate those spaces. So first, if we teach clients how to create their own spaces, and then how do we cultivate them? Because I think that's wonderful. It's not a lot that you hear that as like a follow-up action to creating environments.
Well, I think we talk about safe spaces, but we talk about the boundaries that are needed to create safe spaces. The boundaries that you as an individual can control, you as a therapist and you as a client, patient, whatever your title or your role may be at that point, you have to talk about what are the boundaries for you? What are the things that make you feel safe and secure? What are the things that do not? And then be able to communicate that, to say, you know what, this does not support my good mental health, or this doesn't support my self-care, but being able to discuss those boundaries. But first understanding within yourself, what are your boundaries? What are the things that allow you to feel healthy and to thrive? And what are the things that kind of weigh you down? And to be able to articulate that, to assess that, and then to be able to identify it, okay? Be able to identify it, either to celebrate the good or to say, I need to step away from the negative. And that has been important. Now, when you articulate who you are and your boundaries, it does not mean everyone's going to accept it. It doesn't mean everyone get in formation. It has nothing to do with the other people. It has more so to do with me, because I've articulated who I am in a confident, professional way that wasn't demeaning, that did not break down or destroy the professional relationship or change the climate or atmosphere to something that's negative, right? I still am responsible for leading and growing myself and other people in a way that communicates, hey, this is healthy, this is not healthy, and then move on, right? Because it's important to keep moving, even in the midst of sometimes when maybe boundaries are blurred, or when there's not necessarily good and healthy boundaries that have been, people are following. You still have to lead by moving forward and lead by an example, because eventually, it does fall into place eventually. For various reasons, it falls into place because everyone has learned, okay, this just what makes up a good climate or a good environment that I want to work in, I want to participate in. And also it works in spaces whereas some individuals may say, I can't support or I don't agree with those boundaries that you have for yourself, or I'm not going to abide by them. Well, eventually they'll say, you know what, I'll just move on. But the basic piece is understand who you are as an individual and what your boundaries are, and you adhere to your boundaries. And what I respond to is what I respond to. Doesn't matter what the behavior is of the other person. My response is what dictates my boundaries, or it communicates my boundaries and shows my self-care for myself as well as for the group, And so when I think about cultivating what we do in creating boundaries, I think about really mentorship, being with people, first of all, who can help you to be successful, who can help affirm you. And then I know, and how to affirm other people because it's been modeled for us. We've seen people cultivate relationships that are professional or personal that are just good and healthy. And since we've seen that, then now that's what we begin to practice. And if we, for some reason, get off track, hopefully there are other people within that community or that circle that can say, hey, give you the nudge or the bump to let you know you're a little off a little bit, and because we've created and cultivated a trusting environment, we can receive that information, receive it in the good faith and the good spirit that it was given.
Did you learn all of that in the classroom or from experience?
No, that came from 26, 25 years, almost 30 years, honestly, of experience of living the life as a therapist, living the life of a human being, living the life of a female, living the life of an African-American Black female. All of that has come into place. So I've learned from all of my experiences. They have taught me. There were some that, it taught me hard lessons. There were some lessons that were easier than others, but nevertheless, they all were for my benefit and my good now as I lead as a president, interim CEO. And so I got the theory in the classroom, which was great. I got some experiences in the classroom through practicum and internship. And those things were absolutely wonderful because you need those just by law, but also being able to connect with colleagues and the relationships that I built along the way that helped me to have those accountability groups. I have individuals from my program at Tuskegee University, my graduate program, that I am still connected with, that we would still bounce things off of each other and say, hey, let's consult. What do you think about this? So that is important. And I've had great mentors over the course of the 20-something years. Even now I have great individuals in the profession who I can talk to, who will help me to be the best that I can be. And so that's part of cultivating an environment, cultivating myself to the place that, I understand what it's like to mentor. I understand what it's like to pour into myself as well as other people. And modeling that helps. And that helps to pass it on and to pay it forward, if you will.
Great. I was hoping that would be your answer. Because I'm very, very, I'm such an advocate for really pay attention to your experiences because they do mean something, or at least they do give you a chance to make meaning of them, right? You're going to do that anyway. So you make a great point about understanding our values as service providers and setting those boundaries, whatever environment it is that we're serving in. And then something that I think you've done without actually saying it is to elicit that confidence and that, not that standoffish, but behind those boundaries is the certainty of why you're placing them there and the responsibility to. Mm-hmm. that made me think of how far that approach is from, I at least know, the red armchair kind of stigma that really blossomed in the 20th century, early 20th century, where logic and theory was really, really, really relied on to solve these kind of mental health, problems people were having. And would you say that that is basically or almost completely divorced from the truth now that we're, this far into the campaign to shift perspectives on mental health?
Well, I think when we talk about mental health and we talk about individuals processing through, their stuff and challenges and even celebratory things, I think there's still a place for logic and reason and theory. I think there's a place for some things. And then we have to just be conscious of where it begins and where it ends, what place does it hold? If I think about the existentialists who believe that we're in charge of our destiny and our control, if we think about that, do I think that's true? Absolutely it's true. And we have to do the things and take the necessary steps in order that we can advance. But then there's another piece of, I don't think we can do it by ourselves. I think we have to be connected to other people who can help us, but we still have to be able to put in the work. And we have to understand, how do we make meaning of our life and how do we put in the work? And so when I think about that, I think about, from a cognitive behavior standpoint, what do we do or what can we help teach or instruct or guide so that individuals, yes, be in charge of their own forward movement, but also be deliberate and intentional about it. It's not good enough just to say, I won't change. That's just not good enough. Maybe it's a start, that you have the desire, but we have to also talk about, okay, what are the necessary steps? And then be willing to walk with the individual on that journey and on that path to provide the coaching, the mentoring. And if they're in a therapeutic place or environment, provide that necessary therapy and psychotherapy so that the individual is receiving the necessary tools and resources. Again, it's not enough to say, oh, I want to change, or I want to improve health, I want to improve quality of life, I don't want to feel down anymore. But we have to reach out and seek help from a licensed individual to help us process, what is going on that's kind of keeping us from moving forward. And so in that process, sometimes individuals have to think through, they have to have some logic and some reasoning, but also some interjection of some other information and resources too. So I think the combination of a multitude of resources and instruction and guidance, and in some cases, psychotherapy.
That's wonderful. So, and this is from personal experience and also, other resources and learning the process of how we get through our understanding of our emotional health or mental health. Would you agree with the statement that a lot of individuals will skip over the part where they address and identify what is causing them distress or whatever state of mind that they're in, kind of jump on that toxic positivity bandwagon without knowing it, or maybe slightly deliberately so?
It's interesting that you brought that toxic positivity, and I think I've seen a lot of that. I think during the pandemic, and even before we saw it, yes, we have to be conscious of self-talk. We have to be conscious of saying the positive things to ourselves. And that is important, and being in positive environments. But there comes a time, too, that we have to take a real look at the root causes. What is causing us to be in this space that we just don't feel well? We're just not living our best lives. And sometimes that toxic positivity can prevent us from really looking at the root cause. And a therapist is that person who's set aside, a professional, to help us again to peel back the layers. Because in some cases, some individuals are not aware that there's a deeper issue going on, or that they need to continue to search for meaning and make sense of their lives and what has happened and where they are. And sometimes we need individuals who help us to do that. And that's okay. That is okay that we say, hey, I need to reach out to someone to help me make sense and to understand where I am, where I'm going, but also to help me understand that which may be within my unconscious. How do I bring that forward to deal with it? And oftentimes individuals, when they go through a therapeutic process and treatment plan and so forth, they're the best advocates because they can say, hey, I've experienced, I understand that which I did not understand. And they can also help to push and advocate and to share the message of you're not alone. And they can help to reduce the fear that's associated with getting help for those unresolved issues. A lot of people, don't know what they know, but some don't want to know what they don't know because of fear. Because of fear, what they might uncover about themselves, about their family. And so they live with that dark cloud somewhere because of fear.
Wonderfully put. Yeah, that is something that has popped up in, text I've read in philosophy, sociology, all the human focused disciplines in one way or another. And so it's really great to hear that coming from the counseling profession and a professional. I'm wondering, I want to get to like the diversity part you mentioned earlier, right? And the diversity of the point of having a diverse field of counselors and therapists and psychologists, all that, and how it has played into deconstructing the stigmas around mental health. Tell me more about why that is so important.
It's important. First of all, it's important for people to see themselves in their therapist or to see that or understand their therapist understand. It's important for, any service that we go to in this world, any service that we receive rather, it does help to build a trust or help to build a rapport. If we feel like that individual can identify with who we are, and that's essential. When we talk about therapy, it's important for some cultures to see Black and Brown therapists, to see people of the BIPOC community. It helps them to feel like they're understood and that they're appreciated. It doesn't mean that an individual cannot have a therapy of color or not of color. It doesn't mean that at all. But it just simply means, hey, it's important. It's important not only for the client or the patient to see a therapist of color, but it's also important because we need individuals who can help deconstruct various systems that maybe were in place that was unintentionally not healthy to all people seeking services and being able to access, mental health care services. And so, I've been in the field, as I said, over 20 something, 25, 26 years. And I've seen over the years more therapists of color in the profession. And I think that has been wonderful. But we still have work to do when we're talking about creating, equity, having diverse communities of learning, diversity in leadership. Although I am the interim CEO for the American Mental Health Counseling Association, I am the first person of color to serve in that capacity, even as interim. And we're 45, years old. And so that's important because it says that we're open to different perspectives. We're open to different people. We're open to the gifts and graces that other people and other races and cultures bring to the table. And interesting, with being part of various organizations and leading some and being in spaces where leadership have discussions, I've found in those places that it's still important to talk about diversity, equity, inclusion. Because sometimes we can unintentionally do things that make individuals feel, not important, that make individuals think or feel that they have to check their experiences or their culture at the door before they walk in. They have to check at the door before they'll be accepted. And so I think we still have to have conversations in regards to that so that everyone feels, hey, I'm included. There's space for me at the table, not just for personal reasons, but there's space at the table for me to help advance the profession, for me to help advance mental health awareness, for me to help talk about diversity, equity, and inclusion. And what does that look like? We talk about culture, But also when you talk about what does that look like for individuals, who have had various experiences, whether it's with trauma, whether it's experiences as a female. So there's just so many lenses we can look through and which can help us to talk about so that others can feel included and a part of when you're talking about diversity. And I hope I answered your question. And man, we've gone a long way around to answering it. But if I need to clarify, let me know.
No, that was beautiful. And it drives right into my curiosity about you make what I'll call the bracketing of this field make sense in a way that there is a need for different specialties or concentrations or focuses, expertise. That's the word I was looking for. There is a need for certain expertise to address specific problems. And that also allows, I think, I'm at least I'm hoping, allows room for a more diverse group of service providers to blossom into counseling and therapy positions. But beyond that, do you think the bracketing of the field, and maybe you can even include psychology as a whole, that the breaking up of these lines of thought and theory has done any sort of hindrance to the way we serve people in counseling and therapy settings?
I'm glad you brought that up because I was going to touch upon that, but I thought, okay, let me just pause. But I think if we historically look at our profession, if you look at the big umbrella of psychology, if you will, and look at the counseling, the human services, social work, all of that, we have some of the same theorists. The same theorists and research come from individuals who were not diverse, who did not represent, the total population. Historically, they were white males, and research participants were Europeans or white individuals. And so I think now as we move forward and we talk about being more inclusive, we do that so that we can have theories or integrate theories that will address individuals from different backgrounds who are culturally diverse and culturally different. And that's important. You have a lot of patients, clients, as well as therapists who may feel like, hey, that research was not based on individuals from my culture or from my space, my place of origin, or anything that's resembling to, and I think it's important now that we move forward and be more inclusive, that we inclusive more of theories or hearing the voices of those who were not previously represented in research, who were not previously represented as a founding theorists, theories, and so forth. But now as we become more diverse, that means we welcome more and different thoughts, different people, different experiences to help enlighten so that we can serve in this different age.
Different age is a great way of putting it, because with, just history itself proves that the longer we're around, the bigger our thoughts and more complex and experiences that they get. So it's not only like a want or a desire to have either, someone that looks like you that's helping you get through your mental health, but also it's a need. Like it's going to unfold that way, whether we try to resist it or not. And I'm wondering, this is kind of like the first time I've considered this, but what are your thoughts on our ability to create a culture of resistance, both as individuals who seek services for, counseling and mental health or any human service at all? Do you think that resistance is necessary before either interpersonal or community or even national change can even be considered? Or do you think we resist too much and that we've made it a pattern in specifically like Western dominated thought cultures?
I think the resistance does exist, and because resistance exists, it does. And I want to clarify when we talk about resistance, because it can be two different things. There is a resistance to some in the past of having a diverse representation of founders of theories and just hearing the voices of other people who maybe did not look like, I guess, founding theories for most of them. And so were there resistance in the past? I would say absolutely. But I would say we're moving in a place in time now that individuals have the space to share their voice, they have the space to share their experiences, they have the space to create, new schools of thought or integrate them with others. Now, the issue becomes in if you have someone from the BIPOC community or have someone of color, of so forth, that has a new theory or has something that would benefit a particular population, it becomes in how do we communicate? How do we share that knowledge? What platform is being given to that individual to introduce those schools of thoughts? And so then it becomes an issue of resistance, but it's intertwined with access. It's intertwined with, are you in the right space and time for someone to tap you? Are you in that space and time to connect with individuals who, again, will tap you to give you that platform? Oftentimes, a lot of the BIPOC community are not given the same platforms as other individuals to share those new schools of thought, to demonstrate, hey, I'm here, I'm knowledgeable, I'm educated, I'm credentialed, all of that good stuff. A lot of people are still not given those same opportunities at the same rate, if you will. And those are my thoughts. Now, I know other people may have different thoughts about that and may even disagree. But oftentimes, people of color in the BIPOC community are just not given the same opportunity and the same platforms. And that's one of the reasons why I said earlier, thank you for allowing me to be on your roundtable, because it still is an opportunity to educate, still an opportunity to lift voice and to give voice to those experiences that many have had that are professionals. And to, again, just bring more awareness to mental health care, the access to it, the resistance that's involved, the work we still need to do in diversity, equity, inclusion, and the need for social advocacy, or more of it, I would say.
I think you've brought a whole conversation full circle, and I'm thinking to myself, like, why is there not such a bigger rush to bring new ideas and thoughts and theories into like our reality now? But I understand that it's maybe not necessarily resistance from those who do dominate this, these schools of thought. But again, going back to that representation, the more representation that there is, the louder the voices can be and the more space is created. So that's not to say, it's the responsibility of people in the BIPOC community who counsel to do all of that work alone. But the more diversity we embrace in our service providers, the work that we do, that will eventually, old thoughts will become the minority, right? And so I really enjoy that connection. And let me just tell you, it's an honor to have learned everything I just did in 57 minutes. And I cannot believe all that passed. And I welcome you to come back so we can dive more into the practice itself. I'm sure there's plenty of viewers who want to understand better. Maybe they have an interest in counseling and therapy, but they're reluctant for one reason or the other. So thank you so much for visiting with me today and sitting around the table and talking. And one more question. You teach, and so if you had to give one piece of advice to students as they enter to the human service field, what would that be?
One advice I would give to emerging professionals would be to follow your dreams, serve in a place of your compassion, serve in a place in which your values are aligned, serve from a place of, for me, and I share and I encourage, serve from a place of gratitude. Because there are many reasons and resistance and issues that can prevent individuals from seeking your service. And so serve from a place of gratitude that you're gifted to serve, you're trained to serve, be confident in who you are, seek out mentors who will pour into you and you can pour into them, that it is an equal exchange, exchange of learning and growing. And so I would share with them as well, as if you're looking at a school to go to, look at the curriculum. Make sure the curriculum have classes that interest you, that you want to take, and that will help, again, you to serve and serve from a place of compassion. And that's important. Maintain your values. You will learn, you will grow. There's some things you'll say, I need to do less of, some things I need to do more of, and that's fine. That's part of the process. Do your self-care, okay? But serve and do no harm and do the best that you can.
It is your gift to provide service, or it's your gift to serve. That is, I think a lot of people have to reiterate that with themselves, because for me and a lot of other students, there's a tendency to think, okay, I got to work until I'm the best, possible provider. And then I can, proceed to work with individuals or communities or do the work that I, want to do. And it doesn't work like that. Just like you were saying, it's a learning and exchange. And that, I think, is part of the beauty of what we do, as long as we don't restrict ourselves to go a certain direction or avoid certain, people or ideas. Like, just let it all come to you, because that's what human services is all about for clients and for professionals. Really, thank you so much. I think that you have wisdoms to share, and it's going to go beyond just this one episode. You can find previous talks on our YouTube page. Just search NOHS Organization and click subscribe. All of our social media handles can be found in the description box below. And of course, there is a ton more to learn and do on our website, nationalhumanservices.org.